Okay, Dr. Ray here from Vet Triage. We are continuing on with this issue of JAVMA from January 15, 2015, and we are talking about a unilateral choristoma of the nictitating membrane in a horse. This study comes out of Tufts University in Massachusetts. This is a 2-year-old Morgan mare evaluated because of corneal ulceration. The clinical findings include an irregular deep stromal corneal ulcer in an area of malacia of the left eye. Hypopyon was present in the ventral portion of the anterior chamber with moderate aqueous flare. The nictitating membrane, which is the third eyelid of the left eye, had hairs originating from its leading edge that contacted the corneal surface. Treatment and outcome. A bulbar pedicle conjunctival flap was performed. The conjunctiva at the leading edge of the nictitating membrane, including the aberrant hair follicles, was excised. Microscopically, a non-keratinized stratified squamous epithelium, sebaceous glands, and hair shafts were present, confirming a choristoma of the pilosebaceous origin at the leading edge of the nictitating membrane. Introduction. The horse had marked blepharospasm of the left eye, normal menace, normal dazzle reflexes bilaterally. Palpebral reflexes were normal in both eyes, direct and indirect. Pupillary light reflexes were normal in the right eye, absent in the left. And approximately 10 by 6 millimeter irregular stromal corneal ulcer with approximately 75% stromal loss at its deepest aspect in the area of malacia was observed in the dorsal-medial aspect of the left cornea. Corneal neovascularization was present, extending from the dorsal and medial aspects of the limbus and approaching the nasal or ventromedial edge of the ulcer. The cornea surrounding the lateral edge of the defect was edematous and malacic. And let me just show you a picture before we get too far. There's the really bad ulcer in the horse's eye. So the box there, and then the other image is zooming in, and the arrows are showing the hair at the leading edge of the third eyelid. Several hairs were observed to originate from the leading edge of the membrane of the left eye and irritating the cornea. Hypopyon, moderate aqueous flare, left pupil was maximally dilated. A well-demarcated 3 by 3 millimeter area of pigmentation was present ventral to the optic nerve in the non-tapetal fundus of the right eye. This finding was consistent with posterior segment coloboma involving the retinal pigmented epithelium and underlying choroid. Phonic examination was not attainable. The aerobic bacterial cultures showed Streptococcus zooepidemicus, and the fungal culture had Candida. Cytology showed severe neutrophilic inflammation. Biochemistry abnormalities include low magnesium, low total protein, low albumin, low globulin and prothrombin time, and activated partial thromboplastin time. So this horse has chronic illness as well that they found on ultrasound that showed mild right dorsal colitis. The horse is placed under general anesthesia after being stabilized from the night before. An auriculopalpebral nerve block, supraorbital nerve block, and the retrobulbar block were performed with 2% lidocaine. The cornea was debrided, and the malacic tissue was removed. A bulbar pedicle conjunctival flap was harvested from the dorsal medial conjunctiva and sutured over the ulcerated region of the cornea. All right, and then here's the picture of the surgery. You can see some bruising of the graft as well, but they removed the abnormality of the third eyelid. Okay. The conjunctiva on the leading edge of the nictitating membrane, including the associated hair follicles, were removed, and the resultant wound was left to heal by second intention. Histologically, the leading edge of the nictitating membrane contained a non-cornified, stratified squamous epithelium, sebaceous glandular tissue, follicular epithelium, and hair shafts. And so here in this image, on this side, you can see there that asterisk is actually a cross-section of a hair follicle, and then the dagger is sebaceous glands, and in the other picture with the arrow, that's actually a cross-section of a hair, which of course shouldn't be present in the third eyelid of the horse. So it says there, ectopic air follicle surrounding sebaceous glandular tissue can be seen within the submucosa, and the hair shaft is present within the ectopic hair follicle located at the leading edge of the membrane. Okay, discussion. The nictitating membrane or third eyelid is a structure that normally lies in the ventromedial conjunctival sac between the lacrimal carbuncle and the globe. The nictitating membrane is covered by conjunctiva on its bulbar and palpebral surfaces, supported by a T-shaped fragment of hyaline cartilage. The nictitating membrane contains a lacrimal gland, which contributes substantially to the aqueous portion of the tear film. The primary function of the nictitating membrane is to provide added protection to the globe, sweeping across the cornea in a dorsolateral direction when the eye is passively retracted into the orbit. Histologically, a normal nictitating membrane is covered by non-keratinized stratified squamous epithelium with interspersed goblet cells on the bulbar and palpebral surfaces. The bulbar aspect also contains lymphoid tissue and deep glandular tissue, which adjoins the T-shaped cartilage. A choristoma is an accumulation of microscopically normal tissue located at an aberrant site resulting from abnormal cellular differentiation from fetal development. The most commonly recognized type of choristoma involving ocular tissue is a dermoid, which results from abnormal proliferation of elements of skin and dermis and is composed of a cornified epithelium, variably including hair, blood vessels, fibrous tissue, nerves, glands, smooth muscle, and cartilage components. This is similar to a teratoma that we see in small animals. Dermoids are most frequently located at the temporal limbus, but may involve the conjunctiva, nictitating membrane, eyelid margin, which is termed hemartoma. Oh, that's the other name in small animals too, is hemartoma. Limbus, cornea, or in various combinations. Dermoids develop secondary to defective induction or differentiation of the surface ectoderm and are rare in horses. Another report described bilateral ocular colobomas affecting the dorsal limbus and sclera in a colt. Histologically, dermoids typically contain a keratinized, variably pigmented, stratified squamous epithelium. They also include the regular presence of hair follicles, blood vessels, glandular tissue like sebaceous or sweat glands, adipose tissue, fibrous tissue, and nerves. Rarely, cartilage and bone are seen. Generally, the edges of the ocular dermoids are indistinct and merge with neighboring corneal and conjunctival epithelium and stroma. Other examples of choristomas include the ocular surface involving abnormal or misdirected hair growth that can lead to subsequent corneal and conjunctival irritation. These include distichiasis and ectopic cilia. Both are rare in equine and very common in dogs. To the author's knowledge, distichiasis has only been reported once, and there have been 2 other reports of ectopic cilia in horses. Ocular choristomas containing hair follicles may produce hairs that emanate from the surface and contact local ocular tissues. Irritation causes corneal inflammation, epiphora, and corneal changes, including keratitis, corneal ulceration, and then surgical removal of the abnormal tissue is recommended when aberrant hairs, especially if the resulting corneal or conjunctival irritation and pathological changes, or in cases of dermoids, if the lesions are large enough to cause obstruction of vision. Now, because choristomas result from abnormal tissue differentiation early in fetal development, they can often occur in conjunction with other ocular abnormalities. Examples include microphthalmia, severe anterior segment dysgenesis, aphakia, retinal dysplasia, optic nerve hypoplasia, iridoid hypoplasia, limbal dermoids, as well as anterior and posterior nuclear cataracts. Finally, posterior segment coloboma locations can be categorized into typical and atypical colobomas. Typical colobomas are infrequently found in the retinas of horses and develop secondary to incomplete closure of the optic fissure during embryogenesis. Typical colobomas are located along a plane running vertically from the optic disc into the ventral region of the non-tapetal fundus. Atypical colobomas are seen more frequently, but are still relatively uncommon. These develop outside the plane of the optic fissure and are generally found within the non-pedal fundus, lateral or medial to the optic disc. Colobomas in the equine fundus can affect the tapetum with underlying retinal pigmented epithelium, the retinal pigmented epithelium and underlying choroid, blood vessels, or optic papilla. The coloboma in the horse of the present report can be classified as atypical, given that it was located ventral to the optic disc along a plane in the vertical meridian. So obviously a rare equine diagnosis. This is, of course, for veterinarians just to be aware of the rarity, and also for horse owners to be aware of it. There's really not much to be said from there. Since it's not cancer, I assume that it's curative with surgery, with surgical removal, and they did say this horse did progress to be fine after surgery. So pretty wild. These types of embryogenic abnormalities can result in abnormal parts of the body forming and growing anywhere in the body, and it's wild to when you see them. I've heard of dogs having tumors removed that had teeth in them and hair and other nerves and other structures that shouldn't be in that body part that are just randomly thrown in because of abnormal embryogenesis. So pretty wild case. We'll see you guys again tomorrow. Bye-bye.